Good afternoon, YouTube. Today marks 43 days, or just over 6 weeks since my TLIF surgery, and I thought it's quite a good time to give you another update. As always, there's been both positives and frustrations, so let me share all of those with you, and this time I'll start with the positives. So the biggest step change in the last 2 weeks for me has been the fact that I actually can now spend a full day at work in the office sitting down. What I must say is that hasn't necessarily been the case even up until 10 days ago. Up until then, I did try a couple of days to push beyond the kind of half a day in the office mark, and literally got punished for it, and had to spend the next day or so taking it easy and just resting to recover. But as I say, now it's completely comfortable. I can sit for 2 plus hours in any one stretch of time. Eventually I need to still get up and move around a little bit just to not get too stiff and achy. But in general terms, it's great to be back at that point again. So this is probably quite a good segue to talk about returning to work. So my doctor cleared me to return to work at 2 weeks post-surgery. So what I did was obviously took the first 2 weeks off completely. In the third week, I worked from home entirely. In the fourth week, I then started going into the office, but typically, only spending half a day there before coming home. And then, as I mentioned, I pushed a couple of times and got punished for it. But what is my view now that I've been through the experience? I would say if you can, push for 4 weeks off completely to aid your recovery. And then after that, start phasing in a return to work. Maybe, work from home for the first week, i.e. the fifth week. And then the 6th week, start going back into the office to ramp up. So look, I don't think that most of the doctors that conduct these surgeries that we go for have experienced the surgery themselves. But as I say, to me, 2 weeks definitely a little bit too soon to return to work, given what I've now learned. The next biggest improvement for me has been in terms of the numbness on my left foot. So I think I mentioned before that prior to the surgery, I completely lost feeling on the outside of my left foot, including the 2 outside toes. And I'm very encouraged by the fact that by now it's almost completely back to normal. I would say it's probably at the 80% mark, which has given me quite a bit of hope in terms of being able to make a full recovery from this. Maybe over the next month or so. So looking forward to keeping on top of monitoring that and sharing with you how I progress. But so far so good. Walking has also become more comfortable. So I'm now comfortably able to do like a 3 kilometer or 3.2 kilometer walk, which is about 2 miles. If you don't live in a country that uses the metric system, and it typically takes me about 40 minutes to do 2 miles. Which means my walking speed is more or less back to where it was, prior to getting the injury that ultimately resulted in the surgery. But yeah, making progress on that. And, at this stage, don't feel like I need to go and do 5 miles and, anything like that. Just kind of, continuing to build it up slowly. I've also increased the activity on the stationary bike that I have here at home. So again, I'm not doing anything high intensity, so I'm not pushing to like 80% of max heart rate and, really trying to drive cardiovascular fitness per se. So I take it easy. I kind of sit at about 70% of max heart rate, which for me is about 125 to 130 beats per minute. And it's kind of slowly helping me to kind of build the, fitness back up, kind of as I go along. I did ask the physio, seeing as I was at the 6 week mark, so the physio that was helping me in the hospital, whether given that I'm at the 6 week mark, I should add any additional exercises or whether I should start removing my brace. And the feedback I got from her was to just keep doing what I'm doing until we get to the 2-month checkup with a surgeon, after which we can then assess what we do next. So look, I've seen posts online and videos on YouTube of people that are saying that after 6 weeks, they're back in the gym doing weights and even being told to go jogging, etc., etc. I'll be honest, I don't feel ready for any of that. I think compared to some of what I've seen on Reddit as well, of people that are really battling after kind of 2 or 3 months. I think I'm doing relatively well. But I definitely don't feel ready for jogging or doing any kind of weights. And to be honest, I'm fine with that. So the kind of risk of doing more and then injuring yourself and requiring revision surgery is just too big for me to contemplate doing anything else. Now that I've been through 6 weeks of recovering from surgery, it just isn't a kind of positive, also isn't a pleasant experience. So I definitely don't think it's worth it. But again, each person will kind of recover at their own rate. Various factors come into play, such as the type of surgery you had, how long you were injured before you actually had the surgery, how long you waited to have the surgery, your age, your level of fitness before the surgery, etc., right? So I don't think there's necessarily a recipe for success or a particular timeline that everyone will follow to the T. I think it's something that's very personal, and unfortunately, it does take a little bit of patience to make sure you get through it. So moving on to the negatives or the frustrations. So as I mentioned in my previous video, which was just before, which was at the 4-week mark, and just before that, I mentioned I'd just finished the last of my prescription meds. So if there's one criticism I have of my doctor so far, it's basically that he could have done a better job of helping me to manage the kind of transition from the prescription meds into where I am today. For example, as I mentioned before, I think the sort of thing that could have been done is to kind of phase your way down. So rather than, 4, very, very strong prescription meds at once, going from that and taking it twice a day to nothing, maybe we could have done something like taking it once a day for a week or two, just to kind of start weaning yourself off. And then secondly, they could also have recommended what to do in terms of over-the-counter medication. Once you get to the point where you finished your prescription meds. So I'll definitely be giving them that feedback when I see the doctor in 2 or 3 weeks. But in the meantime, I have figured it out, based on a bit of trial and error on my own part, and also engaging with our family doctor a little bit. So what I am doing is I've gotten myself some over-the-counter muscle relaxants, some paracetamol, or I think in other countries might be known as Tylenol, and then also Adcodol, which is basically a combination of paracetamol and codeine. And then lastly, also started introducing a little bit of ibuprofen into the mix. Now, ibuprofen might send alarm bells ringing in some of your heads, because there is research that shows that if you have a fusion, that any anti-inflammatories could potentially result in a delay to the fusion or a non-union, etc. But I've also found online research that suggests that as long as it's either low dose or for a short period of time, it's highly unlikely that it's going to make that big a difference. But just a reminder that my surgery, it wasn't a classic fusion in the sense that they're hoping for fusion between the L5 and S1 bones per se. Mine was a dynamic stabilization, as I explained before, which was meant to try and maintain some of the motion that was there prior to the surgery. So by all means, consult with your doctor, get their view. But I've just found that the one ibuprofen I take, so I take one ibuprofen, 400 milligrams first thing in the morning, and then nothing else the rest of the day. It really has been quite a game changer in terms of how I've been feeling. So by now, very little in terms of discomfort and pain, just based on how I'm managing it. The second one, which I touched on previously as well, is whenever I lie down, I tend to get sore and achy muscles. So sitting, walking, I seem to be okay. I get tired, but as soon as I lie down and I get up from there, I definitely feel a fair bit of discomfort. So I think it's mostly just because of, certainly up until now and for the next 3 to 6 months, I'm kind of in the activity ramp up period. So I'm doing more and more every day, asking more and more of my body. So of course the muscles are going to get sore, just as they would if you go to the gym after a couple of months out and put in a big workout. So yeah, a bit frustrating. So what that means, for example, is that in the middle of the night, if I want to turn over in bed, it can be quite uncomfortable doing that. And also, I have to will myself out of bed in the mornings, especially now that it's in the middle of winter here in South Africa, just to make sure that I can get out of bed, because I just know that for the first 5 or 10 minutes, it's going to be a little bit uncomfortable. And how I deal with it basically is try and jump straight into a hot shower and just get the blood flowing, and that then seems to make it go away. Thirdly, and probably the one that's been of most concern to me over the last week or so, as much as I'm 100% sure that there was decompression of the sciatic nerve as part of the surgery, I think that the doctor did a good job there, I still have some sciatic nerve niggles. So for example, when I do any kind of nerve flossing and I push a bit too far, or if I try and stretch my hamstring, which by the way is fairly tight on the left hand side, I definitely feel pain, and I feel pain kind of in my glute area, consistent with kind of sciatic nerve pain. Now, the reason I'm concerned about it, or was concerned about it until I got some feedback, which I'll share with you just now, is that, one of two things could potentially go wrong post-surgery. The first is something called epidural fibrosis, which essentially is when your body produces scar tissue in the area where the surgery took place, which in my case will be around the L5-S1 joint. And the scar tissue can then trap the nerve, or the nerve could become attached to the scar tissue and then find it difficult to move. So that was the kind of major concern. Or alternatively, there's something called piriformis syndrome, or deep gluteal syndrome. It's got a couple of different names, which is where the piriformis muscle actually traps the nerve and kind of compresses it in your glute area. So it doesn't actually have anything to do then with the nerve root in the spine, but more so with the glutes. And it can also become attached to the muscles there, which then requires some intervention. So I did ask the physiotherapist about that, because I was concerned, and I wanted to just make sure that I take the necessary action if I need to take action. Her advice to me was it's too early to worry. At the 6-week mark, they normally like to wait until at least 3 months to see how the nerve recovers. And in her view, it's probably just still part of the nerve still having some healing to do. So for now, I'm going to leave it. I'm going to keep doing what I'm doing. But she also did advise, don't push through the pain when you do the nerve flossing or the hamstring stretching, because that can just irritate the nerve as well. So I'm going to follow the advice. And if it's still there, it's still fairly acute, when I have the 2-month checkup with the doctor, I will bring it up with them there as well, and just get their perspective on it. The last part, into the negatives, is just the kind of mental aspects. So let me not sugarcoat it. Recovering from surgery is boring and it's frustrating. And it's boring and frustrating because you can't do the things that you were able to do before you were injured. In my case, for example, going to gym and running and so on, and doing stuff with the kids. Even doing stuff around the house. I mean, you can't even do any DIY work because you can't lift, twist, or bend. So that's fairly frustrating. The fact that you're limited in terms of what you're able to do. But then also in the background, you've got the discomfort and the pain, and trying to deal with the issues around the medication and so on that I've explained to you as well. So between those things, it can become quite frustrating. So I just keep telling myself that I'm making good progress every week, which I certainly am. So obviously I have to see the positives in that, and that there is light at the end of the tunnel. So at some stage, things will be back to normal again. It's only a matter of time. But speaking of time, need to be realistic. It probably could take anywhere from 6 months to a year before things really get back to normal completely. Okay, so that's the update for now. Next big update will be when I have the 2-month check-in with the surgeon, which is kind of 2.5 weeks away from now, which is quite exciting. I'll be having x-rays done at the time. We'll see whether the screws and the rods are still in place, as well as the spacer. And if that's the case, I'm expecting them to clear me for a lot more activity. So exciting times. Going to have to get through the next 2.5 weeks, and then I'll update you at that point. Thank you for listening. And by the way, if you have any questions, please feel free to post in the comments, and I'll definitely get back to you. Thanks. Bye.